Hello, and welcome once again to the Mind Series. I'm Dr. Ryan Thompson. I'm the CEO and Medical Director of Mind Matters Clinic at Murphy's. And this episode is going to be following up on the prior episode discussing adults with ADHD and its impact on parenting. In the first episode, I tried to describe an adult with ADHD and some of the concerns they may have and some of the struggles they have and some of the ways that you might recognize that in another individual or in yourself. In this episode, I'd like to talk about what kind of treatments or what kind of strategies you might develop as an adult with ADHD to make you more effective as a parent and to just basically get by in the world better. Oftentimes what I find when I work in the clinic is that I will see a young individual with ADHD. A parent brings them in because they have ADHD, and we eventually make the diagnosis of ADHD. ADHD is an attention deficit hyperactivity disorder. And I will use that term interchangeably with attention deficit disorder without hyperactivity. And it has the three basic components of inattention, impulsivity, and hyperactivity. Adults, again, just like children, can have a variety of all three of those pieces, and each one can look a little bit different. Adults with ADHD, oftentimes when they bring in their children, will recognize as we discuss their child and their struggles in school and their struggles in doing homework and getting organized and having a messy room and things like that, we'll say, well, wait a minute, I was like that as a kid. And wait a minute, I still have some of those problems. And oftentimes you find that there is a genetic link. 50% of children with ADHD will have one or both parents who also have ADHD. So oftentimes what I end up doing is end up caring for both the child with ADHD and then recognizing the parent also has ADHD, and then trying to work with the parent to say, okay, if you also have these concerns, then that's going to impact your ability to parent, so we need to make sure we're addressing both at the same time to make sure that your child does better. So without treating the parent with ADHD, oftentimes some of the things I may try to implement for the child with ADHD may be less successful, because really to ask the parent to carry through on things that they're asking the child to do when the parent themselves have the problem, that oftentimes you need to address that, and sometimes that becomes the priority. First and foremost, when you work with an adult with ADHD, is to have them assessed, have them evaluated, and come to a conclusion, do they really have ADHD? Sometimes they may not. There's a lot of disorders that look like ADHD and may not be. They may have learning disabilities. They may have significant levels of depression or anxiety. They may have obsessive compulsive disorder. They can have a lot of things that either look like ADHD or, in addition to their ADHD, will change the way that it looks. Most adults with ADHD will have more than one concern. Up to 35% of adults who have ADHD also struggle with depression or anxiety. Sometimes that's because depression and anxiety arrive with the ADHD, but also sometimes adults with ADHD, because they've struggled so much in their life, they develop depression and anxiety. They've oftentimes struggled in school themselves. They have struggled in their relationships. They struggle in the workplace. And so sometimes they struggle with things like self-esteem, because they've struggled so much. They've gotten a lot of negative response from people because of their ADHD activities. So frequently when I'm evaluating an adult with ADHD, I'm always alert to those other things, because once again, just like in the child, if I address just the ADHD in the adult, but I don't recognize that they may have concurrent depression, anxiety, substance abuse issues, history of trauma of some type, then I'll miss the boat and won't be able to effectively treat their condition. Once we've made the diagnosis of ADHD in an adult, one of the primary goals in treating the adults is to educate them about ADHD. Frequently, just telling an adult that they have ADHD can be very validating for them. It can be a relief to them to find out why they've struggled all their life, essentially. And some adults I see in their 40s and 50s before they realize they have ADHD. And then they can look back in their life, and when they find all these struggles that they've had, they go, oh, okay, now I get it. Now I understand why I've had these struggles. Sometimes because they've had struggles along the way, they assume that the reasons that they didn't accomplish things were because they were lazy, because they didn't care, that other things got in the way. They blame other people, they blame themselves for not trying, things like that. They make these assumptions because things haven't worked out, and so they grapple with how to explain these things. So once they have an explanation, then we can both look backward and see at their history and say, okay, this is why you struggled in school. This is why you've struggled in your workplace. And then they can say, oh, okay, now I get that. Now how do I move forward? And so part of that is trying to undo what's already been done. Many adults with ADHD already have an idea of what they can and can't do because of past experience. And so we have to try to reconfigure that. Okay, you may have had those problems before, but if we can give you some effective tools, then you can go forward and say, well, maybe I can change the mold that I've created for myself. So by educating an adult, both with counseling them about what the concern is and giving them appropriate resources to read, and reading, by the way, sometimes is a difficulty with adults with ADHD. Sometimes you have to give them ways of understanding or educating them about ADHD without giving them a big, thick book to read because they may not be able to pay attention to the book. So sometimes you have to give them shorter segments, which is one of the treatment options for ADHD. So again, education is kind of the primary thing, because once you have self-awareness, once you have an understanding of how come you struggle, then you start to be able to understand it, and people around you start to understand it. So if you have a spouse that wonders why you didn't accomplish tasks or you weren't listening, once the spouse becomes aware of it and they become sensitive to it, then you can stop the blaming. You don't have to blame each other for doing or not doing certain things. And that's very, very important, because part of it is motivation. A lot of times adults with ADHD have lost motivation because they've tried and failed so many times to do certain things that they just give up after a while. They say, I just can't do it. I can't pay bills. I can't organize my house. I can't do these certain things. And so again, if you can reframe that, then they can start with a new idea, new hope, and some better motivation to get there. One of the other things I oftentimes recommend for adults with ADHD is exercise. Frequently, adults with ADHD do much better if they do regular physical exercise. And unfortunately, for those who do that, the bad part is it really has to be done every day. Most studies show that adults with ADHD, if they do vigorous physical exercise for 20 to 30 minutes a day, improve their focus and concentration. So I have adults with ADHD who have changed nothing else in their life other than becoming aware of ADHD and then start exercising 20 to 30 minutes a day, and they have a vast improvement in their function. But again, sometimes that's hard, and sometimes for, like many adults, doing regular exercise is a hard thing to do. They can't find the time, they have trouble prioritizing that, but if they can, it's very effective. Exercises change brain flow patterns in the brain, and it improves their ability to focus and attend to things because they have better blood flow into the front part of their brain. Another thing I oftentimes recommend are changes in diet. Similar to kids, adults with ADHD, if you give them a high-protein breakfast, they will function better because we know protein helps with focus and attention. Sometimes eliminating food dyes, just like in kids, can help with their brain function. It's a fairly easy thing to do, avoiding food dyes, and if you try it for 2 to 4 weeks and you find improvement as far as your focus and attention, then you keep doing it. If you try it for that period of time and you don't see improvement, then it's probably not going to help, but it can be very helpful. Occasionally, adults with ADHD also have food allergies. Sometimes that's kind of tricky. Sometimes it's hard to make a real accurate diagnosis, and the only really good way of finding out if you do have a food allergy, which then affects your brain function, is to eliminate certain foods. The most common ones are things like gluten in wheat, casein, which is in milk, eggs, corn, soy, and berries. Those are the most common food allergens, which can cause adult ADHD to be worse. And again, if you eliminate this food and you see improvement, then go with it. It's something, if you can do that, you can find something relatively simple like that, and it makes a significant improvement in your brain function, then it's well worth the effort to continue to avoid that food. Supplements can be useful in adults. Most supplements have a modest benefit when it comes to treating adults with ADHD. Some of the things I usually recommend are omega-3 fatty acids, which are found in fish oil and some fish and some other foods, flaxseed and things like that. And so usually supplementing with between 2 and 4 grams a day of something like that, taken over a period of 4 to 8 weeks, you can see benefit. And again, if you do, it's a fairly simple, inexpensive thing to do with virtually no side effects. So if it works, great. And sometimes it's a combination of the things I'm going to be talking about. So it may be exercise along with fish oil capsules. It may be avoiding certain food dyes along with the exercise. So sometimes it's a process of developing certain strategies to try this plus this, try this and that, and then just work to see what the individual might respond to. There is no one size fits all when it comes to treating ADHD in adults or children for that matter. Sometimes the other supplements I recommend are things like zinc, something called pycnogenol, which is found in grapeseed extract and in pine bark, something called P5, P50, which is an activated B vitamin. Sometimes adults with ADHD have trouble sleeping, and melatonin for them can be very helpful because if you sleep better, you function better the next day. So again, if you have that clue, yes, I have trouble falling asleep at night, I have trouble getting up in the morning, then my sleep may not be sufficient, then I try to sleep better, and I will function. That's true for anybody. I mean, you think, if I've been up all night on call, and I'm exhausted the next day, my ability to focus and attend to something is going to be more limited. So it's true for a normal individual, it's more true for an adult with ADHD. Something else is called cognitive behavioral therapy, and that's really something usually administered through a counselor. And it's a combination of a couple of things. The two things are trying to create strategies which help that individual to work within the confines of their ADHD. If they have trouble with organization, then what are some strategies to help them get organized? What are some routines that they may find useful to enable them to get through the day without getting as distracted as easily? If you have a routine and you follow it every day the same way, if you get distracted, it's easier to come back to that routine if you're familiar with it. I always do this, followed by that, followed by that. Hence, if I get distracted between step 1 and step 2, it's easy for me to find my way back to that second step if I say, oh yeah, okay, this is what I always do after this. So part of cognitive behavioral therapy is trying to find tools that are going to be useful in that individual to enable them to accomplish things they need to do. That can include in listening. They can practice the process of listening and not butting into other people's conversations, not talking over somebody, not thinking through the end of the conversation. The other part of cognitive behavioral therapy usually revolves around the emotional component. As I mentioned earlier, sometimes adults with ADHD have created an image of themselves and have spent a lot of time blaming themselves when they're not able to accomplish things. So their self-esteem takes a hit. They start to assume that anything that goes wrong may be their fault. And they become downtrodden. They become alienated from certain people and things because they've had negative experiences in the past. So a therapist oftentimes who is skilled in that and is aware of ADHD and understands how it impacts the individual has to help them kind of go back and peel back those layers of emotional stuff that's been logged on or added to their burden. Because if I'm convinced that I can't do this, I won't enter into it, or I won't be motivated to do that, again, because I've had so many negative experiences. So if the counselor can say, okay, let's back up, let's look at that opinion you have of yourself and the blaming you've done and the assumptions you've had about yourself and see if we can change those. Because certainly motivation, like for anything, has an impact on your ability to accomplish a task or to listen or to be organized. So if you can increase their motivation because you remove some of the the prior beliefs somebody has about themselves, they're going to be more apt to be successful. Coaching, there actually are people who are paid to be coaches. You can call somebody in another part of the planet and they can become your coach. And some people find this effective. Sometimes you pay these people up to $800 a month and they work with you on a weekly basis to help you become organized, to give you prompts and reminders to accomplish things you want to accomplish. In my practice, there's not too many people that have that kind of money laying around that they can pay a coach to do that. However, sometimes you can find somebody else that will help you with coaching. And it can be a coworker, it can be a family member. If it's a spouse, you have to be careful because sometimes a spouse may use that as a way that seems to be punishing or is going to be saying, I knew you couldn't do this, see, I'm going to have to do this for you. So then it becomes a negative. But if a spouse or a friend or a coworker can really just be there to prompt the individual back to something that they've become distracted, or to give them a gentle reminder. And a reminder is, oh, remember you said you were going to do this today. That's different than, you know what, you didn't do this today, you said you were going to do what's up. So one's going to be received very positively, one's going to be a negative. I have adults with ADHD who surround themselves with people who are very organized. Sometimes these are those boring people who always think inside the box, they're always organized, they don't have a spontaneous thought in the world, but they can be very, very useful to adults with ADHD. They can say, I have this idea, I need to get organized, can you help me? So then this person who is very organized can take this idea and bring it to fruition. Something can be followed through on with the assistance of somebody else. But again, that requires that communication, that awareness between the person with ADHD and the person that they're working with, be it a spouse or a coworker or a teacher at school, so they can kind of organize those sort of things. There are medications that are useful for adults with ADHD. The same medications typically that you might use for a child can be useful in adults. However, the success rate is somewhat lower. Part of that, in my experience, is based on adults with ADHD having learned certain patterns of behavior because of their ADHD. They've learned that this doesn't work for them, so they develop coping strategies, which may not always be the best, but they've learned to do these things over and over again. So to break old habits are sometimes very difficult. If I were to give an adult with ADHD a medication which instantaneously took away the ADHD symptoms that they have, automatically able to focus and concentrate and things like that, it would be unusual for them to suddenly be able to just change, because they would still approach problems with the same sort of strategies, the same sort of coping mechanisms they've used in the past. So usually it's a very gradual improvement that you see if you give an adult with ADHD medication. Nonetheless, it can be very useful, because if you can improve the function of the frontal lobe for an adult with ADHD, this is the frontal lobe, by the way, if you can increase that through medication, then they can start to have the tools that are useful and necessary to do some of those things, like being organized, being on time, communicating effectively, not being impulsive, not being hyperactive or irritable. By the same token, medications oftentimes can be useful if they do have one of those other conditions. What if they have depression or anxiety, or they obsess, or they've had emotional trauma? Then sometimes medication which might cross the bridge between treating both the ADHD and depression may be the best way to go, killing two birds with one stone. So there are medications sometimes that are useful in ADHD, which are antidepressant medications, which are also found to be useful in adults with ADHD. So that's one of those things I would be alert to, saying, gosh, it looks like this person really has a lot of symptoms of depression, yet their ADHD is probably part of that picture. So then might we use, rather than a medication that just treats ADHD, I might use something that would be an antidepressant which has that other benefit of improving their focus and concentration. So again, trying to look at those different kind of diagnoses that may be arriving at the same time. And again, 80+% of adults with ADHD will have more than one condition at the same time. Couples therapy, people with adult ADHD who are in a relationship and have been for a while oftentimes have, again, created patterns in their relationship which may not be healthy. Adults with ADHD have frequently created a history with their spouse or with their kids or with their coworkers which need to be mended. The spouses may have already decided that their adult with ADHD spouse doesn't care, they don't listen, they don't try, they're lazy, they're not motivated. They have all these images. So sometimes having them see a counselor specifically to say, okay, let's back up and let's look at some of those events from the past and say, okay, how many of those might be accounted for by the ADHD? So sometimes you have to go through a process of forgiveness, of rebuilding, of creating new ways of communicating, and trying to undo some of those things that have happened over a period of time. We all know in relationships that you develop attitudes and opinions about other people based on your history. So you have to kind of sometimes back up and say, okay, how can we change some of those historical things and make it better for the future? Parent training. I think all of us could probably use some parent training. All of us base our parenting technique based on what our own experience was, which may result in us either trying to model that things that we thought were positive, or we may be rejecting things that happened in our past and trying to do things differently. So we're all usually basing our parenting strategy based on our own experience. So again, if say that adult with ADHD, their own parent had adult ADHD, maybe some of their experiences as parents weren't the best. Maybe they know they don't want to do this, but they really don't know the best alternative to that. And then if you try to combine that with, okay, I have ADHD myself, what are some effective tools I have to parent my children more effectively as a result? So oftentimes specific parent training can help. You can learn the building blocks of what is an appropriate way to discipline your child, what is an appropriate way to provide what's called scaffolding, which means I create this structure for my child to be successful without doing it all for them. And again, that has to be in the context of what that adult with ADHD is capable of doing. So sometimes it's enlisting the support of the spouse. Perhaps the spouse is better capable of doing homework with their child. Maybe they're better capable of organizing the child's backpack. But again, if the adult with ADHD has struggled with parenting, sometimes getting that really specific nuts and bolts of appropriate parenting is very helpful. Mindfulness training is something that we do at Mind Matters. Mindfulness is a form of reflection and meditation and being aware of what's going on in the here and now. It's been shown in studies to help with adults with ADHD, because oftentimes, again, adults with ADHD are oftentimes thinking about the future, about the past, but not really paying attention to what's going on in the here and now. And that's not just about what's going on with the people and things around them, but what's going on internally. As I'm trying to focus and pay attention to what's going on right now here, what's going on in the back of my head? What am I thinking? Am I anxious about it? Am I thinking, oh no, this is one of those times where I always mess up? Or, oh man, this is something I don't want to be doing. I wish I'd be doing something else. So can you pay attention right now to what you're thinking and feeling, and then can you change that? Can you adapt to that? Can you just feel or experience the thing that's going on without reacting or responding to it? So oftentimes mindfulness training can be very effective as far as doing that. Some specific things that I find useful for adults with ADHD is oftentimes they need to create structure where they haven't had structure before. So they kind of have to force themselves to create that structure. One of the things that's oftentimes useful is writing it down. Okay, I have this thought. Oh, I think I want to do this tomorrow. Okay, an adult with ADHD may think that they can remember to do it tomorrow, but tomorrow comes and they become distracted. They become involved in something else, and they completely forget about it. So instead of doing it that way, write it down. I carry around a notebook with myself at all times. Adults with ADHD do this. And whenever they have a little thought, they just, write it down. So they jot down a list, and then they can add to that list, they can subtract from that list, but they have to hold on to the list. Sometimes that's the struggle. Where did I put my list? So they have to get in the habit of always having that list with them somewhere. Sometimes using electronic planners, using your iPhone, using an iPad, something like that, where they can create those lists, and then they have to check that and reference that frequently. They have to look and say, okay, what were my plans for today? And then halfway through the day say, okay, how am I doing? What have I accomplished? What do I still need to accomplish? So creating that kind of structure can be helpful. The other thing oftentimes we recommend for adults with ADHD is do it now. Okay, I have the idea to do this, and in the back of my head, I think, okay, I got the rest of the day to do this. Well, instead of saying, do it later today, do it now. Because you learn as an adult with ADHD that frequently, if you delay something because of your lack of time planning or your lack of being able to focus or attend to something or becoming distracted, that you have trouble actually accomplishing it later in the day. So if you have that idea to do it now. And oftentimes people become very successful with that. They also tend to do very well when they create a certain amount of intensity. They call it hyper-focus. I'm going to do something and I'm going to make sure I complete it right now. So they become very dialed in. It really helps increase the activity in their frontal lobe, and then they can buzz through it. And they learn that about themselves. They say, okay, don't stop because I might have trouble picking it up later. So if I can start from here and see it all the way through its completion, then I'm going to be much more successful. So do it now is helpful. Using visual reminders, sometimes again like notes or lists or things like that that are hung on the refrigerator, something that goes up on the bathroom mirror, things that are in the car. Visual reminders to say, pick up your kid at 3 o'clock. Okay, put that on the rearview mirror. Okay, I'm not going to forget my child at the dentist appointment when I go away and come back. Those sort of things, you need visual reminders and clues. Breaking down project into smaller pieces. Again, adults with ADHD oftentimes become overwhelmed when they see a big task. They walk into a garage and they want to reorganize the garage. They want to clean it out. But when they look at it, they don't know how to start because they have trouble picturing in their own mind doing something in a sequence. Because doing things in sequence is one of the parts that's difficult for adults with ADHD. They have trouble envisioning doing this, followed by that, followed by that. So sometimes they have to sit down or stop themselves and say, okay, this is the way to break it down into pieces, and this is the way I can accomplish it. So by using it as a strategy and not assuming that you can just jump in anywhere and do it, they have to break it down in those pieces. So it's a very thought out, anticipated process you have to train yourself to do. Using a watch minder, sometimes people use something that buzzes every hour or 2 hours or a certain time of day. If it goes off at 2:30 and it reminds you have to pick up your child at 2:50 and that goes off at 2:30 every day, then that's going to be a useful reminder. You go, oh, okay, yeah, I have 20 minutes to get there. I better stop what I'm doing and head towards school so I'm not late. I have an appointment at 3 o'clock. I better have my watch minder, better set it now, again, do it now, so I know that I have 15 minutes to get there and my watch minder goes off. Automatic bill payments. Some adults with ADHD who struggle to pay bills because they have a pile of bills here, they have a pile of bills there. What if they pay their electric bill automatically? And then they don't have to work on a deadline. They just have to make sure that it's been done, and they have to check their checkbook at the end of the month to make sure they have enough money. And then delegate is the final thing. Oftentimes, if you work as a team with somebody else, you may find within a coworker or with a parent that you can do something more effectively if you give this project to somebody else while you take care of this one. So try to negotiate and work it out with somebody else so you know what works. And again, just if that doesn't work, then try a different strategy. That's it for this evening. Thank you very much for listening.